Welcome back to Mountain Connections. We are going to talk to Lori Weston right now. She is the administrator of the Intermountain Park City Hospital. Many things to ask her about. Really want to check in on the staff, find out how supplies are doing, and learn more about the new drive-through testing that was announced just a couple days ago. So Lori is on the phone with us today. Lori, are you there?
I am here. Thank you. Thanks for having me.
Well, we really want to thank you, your entire staff at the hospital. We know that you're working really hard to keep us safe, really everyone, the medical staff, doctors, nurses, support staff. They're really our heroes during this time, and we know they're working extra hours. How is the hospital doing? What is the emotional state? Is the staff staying healthy? Where's that at right now?
Yeah, the staff are doing great. All of our caregivers are doing well. They're all stepping up to help and get ready to take care of the influx of patients that we anticipate. We're doing cross-training and just getting everybody up to speed. People are doing things that they haven't done in a long time in medical care, and so we're getting them prepared. Intermountain is always training on emergency preparedness, and so we get to put those skills in action right now. But overall, the mood is really good. Everybody wants to step in and help right now.
That's very good to hear. We definitely are so appreciative of everything that the staff at the hospital is doing right now. And I wanted to ask you a little bit about supplies. You've heard about nations and healthcare facilities having difficulties keeping supplies, people having to share ventilators, masks. It's definitely an issue. How's it going at Park City Hospital?
Fortunately, we're part of a large health system with Intermountain Healthcare. And right now, we are good. We've got the supplies that we need. We're in a good position. Our system leaders are also working with our third-party suppliers on contracts of being able to get more supplies as they are needed. So we feel like we're in a good spot. Now, we don't always know, how hard we will be hit and what that burn rate is going to be in the future. But for right now, we feel like we have a good supply, we have what we need, and the caregivers are protected.
How is the patient load at the hospital? Is it feeling very overwhelming? Has it increased recently? Park City Hospital is a smaller hospital, which makes sense for our county, but how is that going? Is it overloaded? Where are we at?
Right now we are seeing some cases coming in for the COVID-19, but as you know, we followed CDC guidelines to cancel elective surgeries, and so our volumes for a lot of our elective procedures have been canceled, so we've been able to deploy resources to take care of patients. Right now we have capacity. We are treating those that have symptoms and getting people the care that they need. Our focus right now is really a lot on screening, testing, finding out how deep in our community this virus is. So overall, we're prepared, and we're part of a large system also that we can tap into for additional resources and capacity when needed.
And just recently, Intermountain announced new drive-through testing precautions, also ways that people can get tested without a physician's note. Tell me more about those.
Yeah, so we do have some testing and screening sites available. Our first request is people use the COVID hotline, call in. There you will be screened by a medical professional, and if you meet criteria, you will be sent to one of our sites to be swabbed, and that would be sent in for testing. We have 2 locations that do the curbside and the swab testing for those physician orders you receive over the phone, and that is the Park City Instacare, the Heber Valley Instacare, and then also we have set up a screening and testing location at the Ice Arena here in Park City on Gilmore Way, where people can come in and also be swabbed. The Ice Arena that we have set up will also do the screening. So if you don't have a physician order and you are having symptoms, you can also go to the drive-through. We are doing those by car only. You'll stay in your car, and we will have a medical professional come and meet with you, go through the questions, see how you're feeling, and then if it's determined that you need to be tested, we will take a swab and we will send that in.
Since we know that there aren't enough tests to test everyone, what are some steps that people should go through before they go to a testing facility?
Really calling the COVID hotline and talking to a medical professional there, and they'll let you know what your options are, what to watch for. A lot of this, the virus is not treatable, and so it's really watching your symptoms, social distancing, staying home, washing your hands, covering your cough, and really watching and making sure that your symptoms don't get worse. If they get to a point where you can't breathe and you're really having some difficulty with your health, then you need to come and see us, and that's when you'll want to come into the instant care or the emergency room.
It must be very difficult for your staff to handle the influx of information. This is a new virus. Things are changing constantly. New research is being done. New information is coming in. How is Intermountain keeping that training up to date when it's changing so rapidly?
That is a really good question. It really is minute by minute, hour by hour. This virus hits a community hard and it spreads fast. And so you go immediately from trying to prevent and stop it from spreading to treating very quickly. There's a lot of communication that's coming out. We've got a lot of people in the facilities doing training and education. We've got experts that are side by side with our nurses, helping them put on their PPE equipment appropriately in order for them to be safe and not be exposed by the virus. So it is really, they're learning as they go in a lot of situations.
And Lori, where can we get more information about exactly where the drive-through testing is occurring, the times that people can go, the hotline they should call ahead of time, and more? Where can we find all of that?
That is on intermountainhealthcare.org. We have a COVID page that you can go to. It'll talk to you about how you access care, where those locations are. Our Instacares are open 9 to 5 for the swabbing, for the curbside service. Our ice arena is open Monday through Friday from 9 to 6. That's the drive-through, and then also on Saturday and Sunday from 12 to 6. Also on intermountainhealthcare.org, there's a COVID system checker, so you can go in and put in what symptoms you're having, and it can also walk you through and give you good information on what to do for your particular health condition.
Thank you so much, Lori, for joining us today. Again, I can't emphasize how thankful we are for your hard work, your entire staff at the hospital, for their dedication to the patients here in Summit County. So thanks for taking the time to talk with us today.
Thank you for having me. Have a great day.
All right, we have more coming up right after this on Mountain Connections. Again, I want to thank Lori Weston. She's administrator at Intermountain Park City Hospital, for talking with us today, letting us know all the updates and everything that they are doing to keep patients, staff, and everyone carefully at their best during this rough time. We have more coming up right after this.